We're going to switch a little bit of gears right now and talk about a benefit of the New York Health Act that is a little bit hidden. And we want to bring this out tonight because we think it's so important. All of the hidden costs in local government budgets and school budgets to providing health coverage to public servants, teachers, retirees. So we're paying not only for our own health coverage too much, but we're also paying, again, through our taxes. So we want to see what the impact would be on these budgets and the potential savings if the New York Health Act were able to pass. And so we have a small panel here, and I'm going to pass it to Steve to start posing the first questions to Darius.
So first of all, I'd like to reintroduce Darius. He's the Albany City Treasurer. He spends his days doing math for us. One of the hidden costs of our current health system is the cost of our local government's private insurance coverage for teachers, government officials, retirees, and then the local share of Medicare costs, which land on our counties in large part. All of this adds up to millions of dollars of costs to local governments that would be eliminated or reduced under the New York Health Act. It says that as a treasurer of the city of Albany, you analyzed what the impact of the New York Health Act would be on the city's finances. I'm just curious, what did you find? I know what I found.
Wow, we'd save a lot of money with the New York Health Act. It really is that simple. I'm really glad Senator Rivera. We're both alums of Gillibrand's office. Myself when she was in Congress, and him when she was a senator. And we talked about this issue a lot on the national level when we were working there. But we really, when I became city treasurer in the city of Albany, which makes me the tax collector and the chief financial officer of the city, I took a look at it on a very granular level. And how do the savings that will run throughout the system with the New York Health Act, the way that Senator Rivera was talking about, which I'm very glad to hear that he was actively talking about the cost savings, because it's not often what we talk about in advocacy for single payer for the New York Health Act. I calculated in the city of Albany that if the New York Health Act came tomorrow, we'd save about 30% of our property tax bills. And that's assuming all the added costs to the municipality from having the New York Health Act, and also assuming that we would put a portion of that of the funding back into the city for what have you. We still would be able to save about 30% of our property taxes, which is a huge amount. It would be the single greatest tax cut in the history of New York State if we were able to do that. And the reason why single-payer healthcare and the New York Health Act will be able to do that is because we spend so much money in our municipalities for healthcare. It is almost half of the entire amount we tax. It's called the tax levy. All of our properties in the city, all of them, almost half of it goes just to paying healthcare for our employees and our retirees. And I want to make one point here on retiree health care, because I saw some comments here about how people who are teachers have lifetime health care because they were public teachers. Don't count on it. Because in the city of Albany, we do provide our retirees with health care, but we are not contractually obligated to do so, and we are not legally required to do so. And I would surmise that a lot of other municipalities are the same. So be cautious about thinking that we have healthcare based on what's public employment right now. You may not. But getting back to the larger point, between the employee healthcare and retiree healthcare that we spend in the city of Albany, that we spend in our school district, that we spend in our county government, and you add in the amount of the Medicaid share that all counties have in New York State, New York counties, they handle themselves. But all counties in New York State have a Medicaid share that they have to put in. So for Albany County, where I live, between the cost of the healthcare for employees and the cost of the Medicaid share, it's actually more than our entire tax levy. We could actually eliminate our county tax entirely if we had New York Health Act. And this is it's true. It varies municipality to municipality in New York State, but it's true in all the areas that we would see savings. But it's also true, as Senator Rivera talked about, it's true in business, and business is coming to realize this too. That I've seen stats where the cost of healthcare, if you want to go out and buy a new car, the cost of healthcare on that vehicle is anywhere between $2,000 to $4,000. That's what we're paying. It's a hidden tax. Healthcare, our healthcare so-called system in this country is a hidden tax on property taxpayers and on virtually everything we buy, because it's how the amount of money that we spend, which is about, I think, 18% now of our gross domestic product. $1 in $6 we spend in America goes to healthcare. That filters down through our entire economic system in a way that really drags it all down. And Senator Rivera talked about this. I love the fact they talked about this from a economic standpoint. What that does, it takes capital that's allocated to unproductive resources, unproductive places, profit, advertising dollars for healthcare, and bureaucratic costs in trying to deny healthcare. It takes it out of that and puts it into productive capitalistic uses. Now, I know that when you're talking about so-called socialized medicine, the glorious capitalistic effects that it will have is not what we often think of. But that's exactly what's going to happen. We will see billions of dollars in New York State immediately go into more productive uses, like making profit for companies. And that is something that businesses are starting to realize. That's something doctors are starting to realize. I come from a family of doctors who are usually loath to have more government intervention with their with medicine and with their practices, but they can't deal with the insurance companies anymore either. You think about the drag that it has in municipalities for what it costs us to pay for healthcare for our employees. It is an enormous cost drag for medical facilities dealing with multiple insurance companies, battling with them all the time. They have to have an entire separate bureaucracy just for that, just to deal with the health insurance companies. And the New York Healthcare Act eliminates most of that. And that's not to mention, from a business standpoint, the cost for your providing healthcare to your own employees and how that is all over the place year to year. Now, this year we're probably going to see a reduction in our health insurance costs to municipalities and to employers, but that's because no one provided health care for anybody for the second quarter of this year because of COVID. So the money that should have gone to health care is not going to go back to the lowering rates for a year before they jack up again. Now as everybody gets caught up on the payments for their health issues. So the bottom line of the research that I've done in the city, I've done for other municipalities around the state, and the Campaign for New York Health also has terrific resources on it, particularly at the county level. This saves a lot of money, and we're talking about how it filters down, not just at the 30,000-foot level, where the healthcare in this country, if we pass single payer at the national level, we would save $400 billion a year. Okay, that's great, but it doesn't really connect. But I can legitimately say to somebody in the city of Albany that if you have a house that's worth $150,000, you can save $2,100 a year on your property taxes if we have new single payer healthcare tomorrow. That's how much this is. And when we talk about single payer healthcare, and Senator Rivera said, talk about it in terms of a human right, and if you think it should be a human right, then we need to fight for it, which is great. And I think I certainly agree with that. Most of us here tonight agree with that. That's great. But make sure to include that it is going to save us a lot of money, because just figure out how much money that you're spending in your municipality and your businesses on healthcare, and take that out, add in what the additional tax would be for the New York Health Act tax, and that delta, which you see on the screen right now, that shows you the money that you can save. You can see, we did. I want to thank Cheryl for putting that together today. This is our the first attempt, the first time I've had actual PowerPoint graphics for me to show it, but you can see it quite clearly just how much we spend on healthcare that we won't have to if we have the New York Health Act. So I've gone on a while.
No, that's fine. When I ran one of the tax proposals against Suffolk County's budget, I found that, first of all, $230 million comes off just because they don't have to cover Medicaid costs anymore. And then I found that their healthcare tax would drop down, I think, from $350 million. Their healthcare payment that they're paying right now for insurance would drop down to 100 and some odd million based on their current payroll. I ran numbers on the Huntington Union Free School District and found that they're paying $22 million for dental and healthcare for their current teachers. Unlike you, I can't even figure out how much they pay for retiree benefits because that wasn't clearly specified. But that same tax proposal, when I ran it on their, on their payroll, $5.5 million. I mean, they're saving over 15 million bucks that they would just have to spend on books or a new baseball field or whatever Huntington Union Free School District needs. Like every time I do this, I just fall over at the numbers.
Yeah, I was when I first started looking at it in this way, I was both astonished and not surprised in any way, shape, manner, or form. Because this is how much we spend on it.
I remember the first time I saw these numbers from you 4 or 5 years ago, I actually had to call you up and ask you, is this really what it is?
Yeah.
These numbers are real, and if I could just jump in, I mean, I think what the other side of this that we want to look at is if we don't do something about this. This is a trajectory that these costs only grow and grow and grow. And we know that for the first time this year, Suffolk County is asking the employees of the county to contribute to their health coverage. And the coverage will only erode from there if something isn't done about that. And getting back to the issue of what you think you're guaranteed as a union member and choice, we've asked Sigrid, who is a retired teacher and part of our group, to share her experience, what you think you're getting if this isn't brought under control, where things are going. Sigrid, over to you.
Yes. My name is Sigrid Mine. And I taught on Long Island. I'm a retired public